everyone. So today I wanted to talk to you guys about some meetings that I had in the past couple of weeks. I visited both my OB, who I've seen from the very beginning of my pregnancy, who I have loved and have had a great experience with, and I did a lot of research and asking around about him before I even went to go see him. I have a lot of faith in him and all that. I went to go see him, and I also went to go see a midwife. Since the birth of Sadie, which she was born via C-section, since she was born, I've done a lot of research surrounding birth, and just I've kind of gotten into all of the different choices and different caregivers that you can have and different options that you can have. And so I've been interested in having a midwife instead of like a doctor, and even interested in home birth. I mean, I've been very interested in that, but I just didn't know what options really applied to me. And so I really didn't think about it too much. I did a lot of looking into getting the right OB for me. And so I did that, and I wanted to have him there at least through the beginning of my pregnancy. I wanted to know, once I got to my 20-week or my 21-week ultrasound, I needed to know that the baby was okay, and that, that there was no huge complications that were going to be visible at that ultrasound that were going to basically limit my options anyways. So I didn't want to put my energy into, like finding a midwife and doing all this stuff if it really wasn't going to end up being an option anyways. So once we got past my ultrasound and everything was perfect, I decided to go ahead and look into a midwife and just kind of see what my options were. So what I did was, I didn't want to just drop my OB because there's really nothing, I knew that he was going to be supportive of my VBAC. I knew that he was going to be a great doctor. I liked him a lot. So I didn't want to just write him off just because he was a doctor. So I wrote down a list of kind of like a wish list from my birth experience, and I took that list with me to my OB, and I also went to a midwife and spoke with her about it. So I want to go over the list with you and kind of just let you know what my items were, and kind of let you know how they approached their answers and how they would help me with my birth. So the first section is pertaining to labor. And so the first thing that I wanted off the top that I knew I was going to meet some resistance with was I would like to be monitored intermittently. I don't want to be constantly on the fetal monitor during labor. There's some practical reasons for this. Basically, just the fact that you're kind of tied to a 6-foot area on the monitor. I don't feel like you have like a great range of movement, freedom of movement, and it's just restricting, and then as far as like research goes, the research that I did, being constantly monitored actually does not have that great of a benefit as compared to intermittent monitoring. You do not save any more lives being constantly monitored. And that's what the research shows, that's just numbers and me looking things up and things like that. So I just didn't feel like it's necessary that I be constantly monitored. I also wanted, that freedom of movement. I was requesting the freedom to be able to eat or drink during labor, not because, that's something that I know that I'm going to want. I don't know that I'm going to want that. I've never been in labor before. I've never even experienced a contraction. So there's really no way for me to know if that's something that I'm going to even want. But I just wanted to know if I had the freedom to do that, because I know that the research says that sometimes eating through labor can help you keep your strength up and can help you be more successful with that. I wanted the choice to be able to labor in water, whether that be, running the shower in my hospital room, or actually laboring in a tub. I just wanted that option. And then I also requested, and I kind of wanted to see what the doctor and the midwife felt about, me saying I don't want to be offered an epidural. If I know they exist, I know what they do, I know all about epidurals. If I want one, I will ask the nurse, I will ask for one. I don't need to be, badgered about it. So I just kind of wanted to get their reactions to those items pertaining to labor. Pertaining to intermittent monitoring, they both said that it's not possible, that I have to be constantly monitored, which is a bummer. But the doctor approached it a little bit differently than the midwife. The doctor let me know, he basically just said you have to be monitored constantly because we're watching out for uterine rupture. And let me just say, uterine rupture happens in less than 1% of the VBACing population. So I don't understand why the doctors and why the insurance companies and why hospitals are so scared of uterine rupture, especially when that 1% actually holds not only like the catastrophic, blowout ruptures, but they also have like the tiny ruptures in that percentage as well. So, but either way, that's what they're looking for. That's the risk that they want to avoid. And so that's why you have to be constantly monitored. But again, by constantly monitoring versus intermittent monitoring, it doesn't save any more lives as far as the statistics have shown. But the midwife let me know, she said, yes, you do have to be constantly monitored. However, I can help you work with the monitors, I can help you move into different positions. This kind of feeds into the freedom of movement as well. She says, I've never had it where a patient has, complained that it's gotten in the way or anything like that. We can work around the monitors. So I think that her approach was maybe a little bit more sympathetic and more, I understand why you wouldn't want to be monitored constantly, but it's just something that we have to do. So as far as that was concerned, I thought that the midwife had a really good, a better approach, one that I was more able to relate to. But also because of the constant monitoring, laboring in any kind of water is just not an option. So that's not going to be an option for me either way. Absolutely not. At least in a hospital setting. Freedom to eat, they both said no. They both said, you have to be ready just in case we have to wheel you off for a crash C-section. So eating is not going to be something that either with a midwife or a doctor is going to be possible. So if I want to eat anything, I need to do it before I get to the hospital. And then this actually surprised me. I figured that with the doctor and the midwife, as far as the requesting that the epidural not be offered to me, I thought that they would both be, oh yeah, no problem. But actually, the doctor told me that it is like a rule that the nurse asks you what your pain threshold is and ask you where your pain is at and then offer you pain medication. And many times that is the epidural. And that was a very big difference from what the midwife said. The midwife said, our nurses are well aware of our patients' wishes and they respect that and they have no problem, laying off of the, pushing the epidural and things like that. So that was a very big difference. So as far as like the labor category, I would definitely say that the midwife won out on that one. For the birth, this is kind of just run-of-the-mill type things. I wanted the infant to be placed right on my chest after the birth. I would like the umbilical cord to be allowed to continue pulsating until it stops on its own. And then I would like the placenta preserved for encapsulation. And then the other thing that I thought would be probably the most different between the two of the midwife and the doctor would be that I wanted the use of essential oils or things like that to help prevent tears rather than going straight for an episiotomy. But actually both the midwife and the doctor agreed on that one. That was something that they both said, oh yes, we use oils, we use warm compress, we do everything that we can to help you, to stretch and be able to get the baby out. And the doctor said, he said, I really don't like doing episiotomies. He said sometimes that people justify it by saying that it can prevent a tear, but it just doesn't make sense because if something is already cut, it's more likely to tear than if something was whole. So I thought that his answer I was really happy with his answer on that, but kind of tied with the midwife. Her answer was very similar. The midwife was very gung-ho about the placenta preservation. The doctor didn't have a problem with it. He said, yeah, it shouldn't be a problem. The umbilical cord, they both had similar answers, except for the midwife said that is their standard of care. That's what they do, unless asked otherwise. And the doctor was like, oh yeah, we can do that. So that's a little bit different. And then of course, both of them said, yeah, barring any complications, the baby can be put directly under your chest. So there was a lot of similarities between the doctor and the midwife, not too many differences. But again, just asking these questions, I felt like the midwife was a little bit more understanding of where I was coming from and why I would be asking these things, whereas the doctor was kind of like more, oh yeah, we can do that, but it wasn't coming from a place of I don't know, it's just different. Maybe it was because he's a guy and the midwife's a female. I don't know. But I don't know, it's just more of a sense of relatability with the midwife. And then the last section of kind of wish list items that I had was pertaining to if I did end up having to have a C-section, because I understand that I'm going to try my darndest to have my VBAC. It is something that I'm passionate about and I want wholeheartedly. It's something that, you know, I'm dreaming about and I really want it to happen, but I have to be okay with the fact that a C-section may have to happen. And so because of that, I wanted to make a little section of wish list items for if a C-section were to become unnecessary. So the first one would be that I want the baby shown to me as soon as she's pulled out of my body. With Sadie, whenever they pulled her out, they immediately took her over to, and I mean, she came out crying. She was completely fine, and they took her over to the warmer or whatever and dried her off and cleaned her up and all this stuff. And by the time that I got to see her, she was a clean and swaddled little baby, and it was kind of like, you know, one minute I'm pregnant and the next minute there's this clean little baby right there that looks like me. So, it was kind of like a disconnect. And so for this time around, if I do end up having to have a C-section, my one request would just be, or one of my requests would just be, if they could pull the little curtain down that's hanging in front of my face and just show her to me while she's still gooey and yucky and messy. You know, because if she was born vaginally, that's what I would see. I would see the gooey baby. Whereas, you know, with a C-section, they clean them up. So that's something that I really, really wanted. And in order for me to really connect with my birth, I think that that would be just a small way that they could help me to connect with that. The second one would be, I want the child on my chest as soon as possible after the birth. And this is not like, you know, cut and dry. It's more subjective than objective, you know, depending on the situation and things like that. The midwife had told me that the doctor that she works with, they've never, I guess what they refer to it is a gentle C-section, and I've never heard that term before, which is odd because I researched everything, I feel like. So I'd never heard of a gentle C-section, but apparently, you know, with a gentle C-section, they try to get the baby onto the mother's chest and allow her to breastfeed as soon as the baby's born, or as soon after as possible. And the midwife said that the OB that she works with has never done that, but if mothers keep requesting it, then they'll know that this is something that they kind of, you know, maybe need to work into their repertoire of things that they allow. And then whenever I spoke to my OB about it, he actually said, yeah, that didn't seem like it'd be an issue as long as it was okay with the anesthesiologist and the nurses. He said that there shouldn't be a problem at all. So I was really, really surprised by that. And then, of course, the third thing would be that the placenta be allowed to be preserved for encapsulation. And both of them, again, were fine with that. So in the case of a C-section, actually the doctor wins out for me because, you know, he did say that he would try to approach the C-section with more of a gentle attitude, I guess. So the midwife wins for the labor and the birth, but as far as C-section, you know, my husband and I felt more comfortable with him with staying with the doctor. And that's hard because, you know, a C-section could happen, but do we want to make a decision on the next, you know, 17 weeks of care and of the birth, just assuming or thinking that a C-section could happen? You know, how should we make our decision? And so that was something that my husband and I discussed a lot because, you know, if a C-section were to happen, those are the things that I would really want, and those are the things that the doctor said he could do. And it's not like he had that many different points from the midwife, you know, in the other areas. It just was a little bit different. So that was something where we were like, should we stay with the doctor? Should we go with the midwife? But then there was another thing that came up, and that was I had asked the doctor if he worked with any midwives, because the midwife that I'm seeing, she works with her own OB, so I couldn't see both of them still. So I'd have to see her OB if the need arose. Sorry. So I asked my doctor if he had worked with any OBs or any midwives, and he said that he used to work with a midwife, but they had to change their malpractice insurance, and so when they changed their malpractice insurance, they had to let her go. And that was something that really stuck out to me, because if their malpractice insurance doesn't cover a midwife, do they have a different view on VBACs in general? You know, because they have a great reputation. You know, there are many moms that will recommend this doctor, but they've seen him before they changed their insurance. So now that their insurance has changed, is their approach going to have to change? Are they going to be not as VBAC friendly, even though they want to be? You know, because doctors are not always run by their own beliefs. They have to go by their malpractice insurance as well. So the fact that they had to change their malpractice insurance and that they had to let their midwife go, that was kind of a sign to me that maybe, you know, maybe their policies are having to change too, and maybe they're not as lenient when it comes to VBACs, or I don't want to say lenient, but maybe now they're more cautious and more careful, and I need a doctor that's really believing in what I'm trying to do. So for that reason, and for, you know, just the approach and things like that, I felt like going with the midwife would be something that I'm more interested in at this point. So I went ahead and I'm gonna go ahead and transfer my care to the midwife, and I'm really, really excited about it. My husband was still kind of on the border. He feels more comfortable with the doctor. Nobody in his family, nobody that he knows has ever had a midwife. They've always had doctors and hospital births, and so I will still be giving birth in a hospital, but he's just never dealt with a midwife before, so he's a little bit hesitant about that. A lot of people, like my mom knows nothing about midwives, so it's gonna be, you know, an educating process. I'm gonna have to educate my mom and my husband. I want them to all be on board, but my husband has come to the point where he's like, you know, it's you have researched it, you've done everything that you want to do. If you feel like this is the right thing, then we'll go ahead and go with the midwife. So I'm excited about it. I have my first midwife appointment at the end of the month, and we'll go from there. So I'm really, really excited. I just wanted to tell you guys about that little, you know, tidbit. I haven't really been keeping up on my weekly updates, but this was kind of a big event that happened over the past couple of weeks, and I wanted to share it with you guys. So I'm sorry that this video was so long. I hope that you guys stuck through to the end. I appreciate you guys being along with me in my journey. I love hearing, you know, seeing your comments and talking with you guys. So I hope to do more of that soon. All right, I'll talk to you guys. Bye.